Friday, Baylor College of Medicine and Friends of Baylor. Well, my sister's been after me again. She goes like, I got a lot of questions, and where are the answers? And actually, I've been running into a lot of people who keep asking me stuff. So today, we're going to focus on your questions, and the answers are by me. I think all management will disavow the answers, but we'll just go with it. So a lady stopped me in my apartment and said, I am so confused. I don't know what vaccines to get. What should I be doing? Can you just tell me quickly what they're? And I said, I promise I'll tell you. But she's got to watch this week's video. So first of all, let's go talk about COVID. Everybody should get a COVID vaccine. If you're over the age of 60, definitely get one. And the way it works is it's 2 vaccines 6 months apart. So if you get one now, 6 months from now, you'll get a second one. That's because the virus keeps changing and the mRNA vaccines don't last as long as we wish they would. Okay, flu. You should be getting your seasonal vaccine now. And it's an annual vaccine, changes every year based on what the flu virus is that are circulating. Pneumococcal vaccine for over the age of 50. That regimen is 2 shots, 1 year apart. That should protect you for 10 years. People forget about tetanus every 10 years. If you're traveling, you don't want to get tetanus in a foreign country, so every 10 years. If you're over the age of 50, the shingles vaccine, that's 2 doses of the vaccine. You don't have to get it again. And then we've talked a lot about respiratory syncytial virus, RSV. If you're over the age of 60 and increased risk, you should definitely get a single dose of the vaccine. And right now, and that's just suggested 1 dose, you don't need to get it again. So hopefully, that's everything you got to know about vaccines. I hope that helps. Okay, now this is another one. This is because of what's going on in the news. What about all this fluoridation of water stuff? So this is actually a really interesting story. It's like people are always forgetting history, but fluoridation, tooth decay was one of the biggest problems with public health. Most people experience severe cavities. Most adults lost most of their teeth. And tooth extraction was primarily the main treatment for decay. Just pull the tooth out. Remember George Washington and his wooden teeth. That was because they didn't know anything about dental caries back then. It was so bad in World War I and World War II that they created the National Institute of Dental Research in 1948 to try and eliminate caries, because that was the biggest problem. So the very first community to get fluoride in the water was Grand Rapids, Michigan. They followed that population for 10 years, and they found not only it was safe, but it was effective in reducing dental caries. Fluoridation of community drinking water to prevent dental caries is considered one of the 10 most important things ever achieved in the 20th century around public health. So, now of course, because people don't get bad anymore, forget about it. So let's just get rid of it. Bad idea. But let's talk about where it comes from. So where does fluoride come from? So fluorine is the chemical compound. It is the 13th most common element in the Earth's crust, and it's found all over the place in soil and water. Fluoride is the salt version of that, so sodium fluoride or calcium fluoride. Just like sodium and chloride are the elements, and sodium chloride together is a salt. Why is it added to water? Well, fluoride in water has been shown to be very effective at preventing tooth decay. It is deposited in enamel and in bone and makes them stronger and resistant to cavities and reduces cavities by about 25%. Here's another poorly known fact. Does the Fed require it? No. The CDC does not require a certain level. The Public Health Service recommends that you have fluoride in the water at about 0.7 milligrams per liter, but state and local governments decide whether to do it, whether to implement fluoridation, and sometimes even on local ballots. So it's determined by local communities. It's not mandated by the feds. When is it too high? Well, if it's over 2 milligrams, the community, whoever's managing the water supply, has to notify folks that there is a high risk, and if it's over 4, there actually you must create filters to lower it. And the complication is that it's too high. There's something called fluorosis, where the salt precipitates in the enamel and it looks like little white specks on the teeth. So that's a problem. People have done all the toxicology. It doesn't cause cancer. There have been studies from countries that have high fluoride in the water during pregnancy that children have been born with neuropsychological complications like attention deficit syndrome. So too much fluoride is really bad. You shouldn't have that. But too little causes a lot of tooth decay. And if you just manage the water supply of fluoride in the water, it's actually a huge benefit. Now, for countries that don't have fluoride in the water, remember Mike Myers as Austin Powers? And one of the things they did to make him funny was they had really bad teeth, as typical of the British back then in the 60s, because only 10% had fluoride in the water. So we don't want to go looking like Austin Powers. Yeah, baby. I mean, I don't think we do. And of course, Singapore had a big problem with 50% of its kindergartners showing up with tooth decay. And so they did a big project to increase fluoridation in the water, and it's reduced caries by 50%. All right. So just eliminating fluoride in the water is like not a good idea, unless you want to go back to looking like Mike Myers. All right. So I got one question. Do you expect this to be a bad flu season? I think it's going to look like all the seasons we've had post-pandemic. Remember, during the pandemic, flu almost disappeared in Australia and the United States. After the pandemic, it's come back to be like pre-pandemic levels, and I think it's going to be about the same. Is this year's vaccine for flu protective? Yes, it is. It's a trivalent vaccine that has H1N1 and H3N2, which are the ones that are circulating, and the influenza B Victoria, which is not around too much right now, and of course Yamagata disappeared. So it is a trivalent vaccine that is matching what's circulating around. Somebody asked me, can you get flu more than once in a season? Well, it's possible, and you can even get flu and COVID, but it's pretty unlikely. Most people don't get it twice. Someone asked me, is the nasal flu the best option for me? So interestingly enough, FluMist, which is the nasal flu, is approved for people between the age of 2 and 50. It's called cold adapted. It's actually, they grow the virus. It's a live virus, attenuated virus, that only grows at very cold temperatures. So it only sort of grows in the tip of your nose where it's colder, won't grow inside you. Very, very effective. But the concern is because it's a live attenuated virus, if you don't have a good immune system, it might be more problematic. So that's why it's recommended for people under the age of 50. Are there people who should not receive a flu vaccine? Well, infants under the age of 6 months don't get it. And also, if you've ever had a complication related to flu vaccine, history of Guillain-Barré or something like that, or those who are allergic to components of the vaccine. But other than that, you should get it. This is an interesting one. If you have a cold but you test negative for COVID and flu, what do you recommend? Well, if you've tested negative for cold and flu, then you probably just have another one of the many circulating viruses we've talked about. And, stay home, don't infect your friends. Rest, get hydrated. If you get worse, non-flu and COVID, respiratory infection should resolve pretty quickly. And if you're not getting better, then you should talk to your primary care provider. This is another one that a lady in my elevator asked. When do you expect COVID to start coming back? Well, I pulled the data for the last couple. This is last year, and it really hit in February and March. So, COVID is sort of on a cycle more like in the early spring, February and March. That's when I expect it to go up. Right now, as we've talked about over the last several weeks, COVID's very low in the wastewater, so it's not really going, but influenza is what's coming up right now. It seems that some people are starting to test positive for COVID even without serious symptoms. Is that common? Well, yes, it's getting to be more common because we now have immunity against COVID. It's not like a new virus. We've either had it or we've been vaccinated by it several times. And the virus itself has mutated to be less pathogenic. So combination of, people getting sort of general immunity and the virus getting, less pathogenic means that people are getting more and more mild conditions. But I still absolutely would get the vaccine. Can I get COVID and flu shots at the same time? Yes, it's convenient, has no risks. If I received the COVID vaccine in September, when is the earliest I can get a second shot? I'm over the age of 65. It should be in 6 months, so spring. If planning a second COVID vaccine this spring, should it be by the same manufacturer? I get this asked a lot. Really doesn't make any difference. You can either one. Do you recommend the new home test for COVID and flu? I think that's very cool, thing. Figure out what you got. The main thing is to make sure you don't have COVID or flu so you don't infect others. But yeah, I think that's really great. I don't have any of those kits. I still have just the COVID flu kits, the COVID kits. I'm going to get some of those, though. I'm just finishing chemo treatments. I will be around family for the holidays. Are there any special precautions I should take or ask them to take? I just make sure that people aren't symptomatically ill when they come visit you and make sure they're up to date on their vaccines. So a sniffling little kid that has never been vaccinated, I'd stay away from that. And your brother-in-law you don't like, just tell him you don't want to see him. It's a great excuse, Okay, is there anything people with chronic issues can do to lessen the severity of illness in addition to vaccines? Yeah, there's antivirals now, right? Tamiflu for influenza and Paxlovid for COVID. And get your RSV vaccine. That way, if you're vaccinated against all these things, even if you do get them, they're going to be milder. But if you are sick, you can just take Paxlovid or Tamiflu. Are there ways to boost the immune system in addition to vaccines? I wish there were. There's nothing that's really documented to do that. There are things you can do to ruin it. You can smoke a lot, drink a lot, be overweight. But if you can, if you're fit and don't smoke, and that's the best you can do. And get some sleep. Is there anything I should know about COVID-19 flu or all the other diseases when we're traveling to Europe for the holidays? Yeah, be up to date on your vaccines and have a wonderful time. That's what I would do. Somebody asked me, can a nicotine patch help with long COVID symptoms? I didn't know about that, so there were two articles. One was sort of positive that it could help, and one was inconclusive, so I don't think the data are in. Oh, I'm going to end this one. Are West Nile virus and dengue fever similar, and do we have to worry about either one in Texas? Yeah, they're all over the place in Texas. They're both mosquito-borne viruses that can cause similar initial symptoms, but they're different. West Nile can range from asymptomatic to actually having a severe meningitis or encephalitis. Remember, Tony Fauci got it from a mosquito in his own backyard. And dengue fever is characterized by sudden onset of fever, rash, and severe joint pains and muscle pains. West Nile virus is spread by the Culex mosquito, and then dengue is spread by an Aedes mosquito. So we have more Culex in Texas, so West Nile has been a bigger problem than dengue. But dengue is, as the mosquito population moves up, it's going to be a problem. That's enough. I can't take any more questions, so I'm going to stop. So I'd like to end today with a couple of shout-outs. Actually, first of all, I want to shout out to Delia, Danila, and Suzette Roldan with the Graduate School for Biomedical Sciences, and Salman Nassef with the Department of Molecular and Human Genetics, who volunteer every week in the GRAB, our food pantry that helps students by supplementing their food supply. These volunteers help unbox food, stock shelves, and bag the bags for students to take home. So thank you all for doing that. Also, congratulations to Dr. Richard Fennell, Professor of Molecular and Cell Biology and part of the Center for Precision Environmental Health, who received the Lifetime Achievement Award from the International Federation for Spina Bifida and Hydrocephalus. So congratulations, Dr. Fennell. And finally, I want to congratulate all of our faculty that work at Baylor St. Luke's Medical Center and the executives over there. We earned an A rating from Leapfrog Group, which is an independent, not-for-profit watchdog that focuses on patient safety. So once again, fabulous hospital experience over there. If I were sick, that's where I would go. Anyway, I hope you have a wonderful weekend. I hope you have a great Thanksgiving, and I can't wait to see you next week.